This meeting was a very, very important one and a very interesting one for the male. Male infertility has been neglected for decades. The male is an important part of the equation. It's not surprising that 50% of infertility is due to the male, and yet in medicine, we have not been paying attention to the male. But over the last couple of years, that has changed. And this meeting had some really important parts that discuss that change. One part is that for the man who has no sperm in his ejaculate, and there are many, about 1 out of 100 men have this, there is so much we can do for him now that we couldn't do before. We can find sperm in his testis. And in fact, we've reached a point at which we can make more sperm using hormonal therapy in his testis and have a higher chance of getting it out, as well as a chance of him developing sperm in his ejaculate and not needing surgery at all. And this was a really important and interesting area that was discussed at this meeting. But the other area which is really, really important is that infertility isn't a condition all by itself. It's related to other medical conditions in the male. For example, low testosterone. Testosterone is so important in the male for all sorts of kinds of general health. And a male who has problems with fertility, especially who's not making sperm at all, has a much higher chance of having low testosterone. And if he has low testosterone, when we treat him as a young male with fertility, he has problems in the future. So we need to be aware of that and to take care of that. Likewise, these men have a higher chance of cancer. We need to follow these men and make sure that they don't get cancers that they're at risk for down the road. And there are other medical conditions that are related to infertility in the male as well, including depression and diabetes that we also need to be aware of and to follow as this man who was diagnosed when he's young goes through life, and so he doesn't have the ravages of these diseases. A man is much more than his sperm. These were topics that were discussed at this meeting and that are new and interesting and relevant and are a real credit to this meeting for opening up a discussion around the male as a very important part in reproductive medicine.